Okay. What about you?
So thank you so much for coming. It's so great to see you all here. So this is the first network event of Mevident Practitioners. Things like depression and diabetes and those things, first, these can be actually prevented. We could have prevented those diseases if we had sufficient wellness services to the population. Second, when someone gets those diseases, it could be reversible through the wellness services.
And we're going to be kind of demonstrating on this panel today of how you might work with your clients, with other practitioners. So, you know, the beautiful thing about Mevident is it really is about collaborative wellness. And that isn't just having your client work with you solely, but really noticing that you can't heal everything that this client may come with me. But I'll just give myself a little introduction, and then I want to let the panelists introduce themselves. So I've been working in personal training and nutrition and in coaching and psychotherapy for a long time. So I really believe in the integrative model.
I'm Stephen Ducat. I'm a naturopathic doctor and a clinical psychologist, licensed in California in both professions. And consistent with that, I'm interested in bringing the two together in the form of an emerging discipline called integrative mental health, which joins psychotherapy with science-based natural medicine and nutrition to give people an alternative to traditional psychopharmacology, but more than just an alternative, to try to get to the upstream causes of their distress, and those upstream causes vary from person to person.
Hi, I'm Ricky Fishman. I'm a chiropractor, and I've been practicing in San Francisco since 1987 down on Union Street. And have always I believed in the sort of integrative model. And in my clinic, I've had through the years chiropractors, massage therapists, medical doctors, osteopaths, acupuncturists, pretty much anything you could think of at varying times. So I've always really believed, not just in theory, but seen how in practice an integrative model approach, how it works, and how I believe that at this moment the changes that we're going through in healthcare are very dramatic, very radical. And on one hand, it's a scary time. People are losing their health insurance, deductibles are going up, options are going down. That there's actually an opening within this crisis for new models to emerge.
Hi, my name is Miranda. I am a family acupuncturist. I've been practicing here in San Francisco for a couple of years. Really, we have this disconnect in the medical system between, there's all this talk about eating healthy and holistic and things like that, but people just kind of let it get away from themselves, and then they don't really address the issue until it's like a last resort. And so a lot of the money is put into these last resort things. And so why I do family acupuncture is because I really think that it's important to get this into the ground level, into kind of creating that awareness at a young age and kind of spreading that throughout the family.
Hi, I'm Dylan. I'm a physical therapist with Red Hauck, and we have a clinic right here in the Jewish Community Center. We also have one downtown in Berkeley, and we work with them for about 7 years, and as a PT for 9 years. And at Red Hauck, we do try and have a very holistic approach to physical therapy. And that means we offer Pilates-based methods and a lot of yoga integration, some more Eastern techniques with the acupressure. Do some cupping every now and then. So that's kind of our own approach. But then on top of that, we do like to collaborate with other practitioners.
As a naturopathic doctor with a functional medicine orientation, I'm interested in treating causes, not disease names. And to do that, it's really important to know what's going on at a cellular level, what's going on nutritionally, what's going on psychologically. So I use a lot of laboratory tests for the physiological piece. Lab tests that don't just look for in-stage pathology, but look for upstream imbalances.
If this person showed up in my office, she would be showing up because of the back pain complaint, most likely. And in the course of doing history, it's very important, even though someone's presenting with back pain, to get a complete understanding of what are the other things that are going on with them, both in terms of in their work life, what's going on socially, what are the things that may be contributing mechanically, or I should say physically, biochemically, to the stresses that have manifested in back pain.
All of the things that I see that are definitely correlated, everything is intertied, but a lot of that with acupuncture herbs, by bringing balance, a lot of those should resolve, but I would definitely, refer out. I often refer out when people have pain to physical therapy because I don't find that acupuncture sticks if people go back into that same physical habit.
And then make sure she has an exercise modality that she likes, that she wants to stick with, because, I could show her the theoretical exercises, but she's not going to stick with them. I think she's got so many other things going on in her life. She's not the kind of person that's going to respond to a litany of things to do and a lot of homework. So I really, would have to connect with her and see if we can find some way to integrate these into her daily life.
I used to be the wellness coordinator, and I also did personal training here at the JCC, and that is how I met Dylan over here. And I actually referred a lot of my personal training clients to Dylan. But because I was only able to go so far with this client, if I wanted to teach this client how to run or whatever, and they had an injury, they kept re-injuring, then Dylan and I could work together, and he would say, okay, I've given her these exercises, or him these exercises to do, and I could follow up and make sure, so did you do those exercises? In addition to what we were doing.
Who is the assigned default gatekeeper? And based on what categories get checked off by the patient?
Well, I think sometimes it comes down to who the patient has the greatest rapport with, right? So whoever has the greatest rapport, they feel like they can communicate best with that practitioner.
And every patient is going to be different in terms of where the center of gravity is for that particular person. For one person, it might be psychological. Someone else, it might be gastrointestinal. Someone, it might be low. Someone, it might be structural. So it varies from person to person, and so whoever is the kind of initial contact person will have to make that kind of assessment. As, where is the center of gravity for this person? And
it's not only a matter of I can't do it, so I'm going to have another practitioner in there, but the conversation that takes place among providers who are sort of accepting, okay, we're on an even playing field. There's not this hierarchical relationship, between providers, so that you and I talking about this, this patient, all of a sudden you're bringing up a perspective that I had not thought about.
To me, this is an aspiration more than anything. The reality is that we are each trained in our particular thing, and I know I tend to make sense of things in terms of what I understand.
For this kind of system to work, there's a value that has to be brought into the foreground, and that is being able to tolerate uncertainty, being able to feel okay about not knowing. I think one of the downsides of conventional medical training is the notion that one must know everything, and if you don't know it, it can't possibly be important. One of my supervisors said that, and this will always stay with me, about and that is, you have to hold a position of uncertain conviction. And I like that because, one, it contains the piece of uncertainty, but without sacrificing conviction. So you can speak with passion. You can take a stand. You can think you know something, but you also, and be able to assert it, but you have to hold the possibility that you really don't know. That you can never have the whole picture.